Hello, this is Chelsea Marks, and I'm here to film VETT 222 task number 7, which is a heartworm test via antigen method. So I want to draw attention here again to our OCCI certificate there on the wall, and then I'm going to go ahead and zoom in onto our supplies that we have for this test. So down here we have our manufacturer's instructions, we have our patient record, we have our conjugate and our tube. We have our patient sample, which is an anticoagulated EDTA blood sample for patient Antigen, and we have our IDEX heartworm snap test. Also a little pipette to place the patient sample into the tube. So this test actually runs for 8 minutes. So we're going to go ahead and add 8 minutes onto our timer. We're going to use, according to manufacturer's instructions, this is set out for 30 minutes and become room temperature, as well as the test itself has set out. So both of these things are room temperature. We're going to use 4 drops, which here we are, 1, 2, 3, 4. Recap that, and then we're going to use 3 drops, I'm sorry, of patient sample. So we have 1, 2, 3. Recap that. I'm going to invert this tube to go ahead and mix the sample together really well. And then in our snap test here, this is the well that you introduce the sample into. Go ahead and dump the entire contents there. And then on a flat surface, we're going to place the test down. And once the blood and the conjugate reach over here to this window, we're going to snap it down. So we kind of have to wait right now until it's to the window. Okay, so it looks like it's reached the little window, so we're going to go ahead and snap it and then hit our timer for 8 minutes. And we'll come back and finish and read the result. Okay, this is Chelsea Marks again for VETT 222 task number 7. We're coming back to read our heartworm antigen test after 10 minutes. So we have our, 8 minutes. So this is the canine heartworm antigen test by IDEX. And according to manufacturer's instructions, 1 control dot should show up if we are heartworm negative. So it looks like we have just the 1 control dot. So I'm going to go ahead and record in the patient chart here that we are heartworm negative. And so they are now allowed to purchase the heartworm HeartGuard or Trifexis is their choice here. For patient Antigen. Okay, and that was VETT 222 task 7.